So I am thrilled to be here with you all today and to talk about BioRoot flow. So as you all can tell, I am young. So as an endodontist, my career has been relatively short, if you will. But I've been using primarily bioceramic sealer in dental school residency and then clinical practice for about 5 years. And so bioceramics, I feel like they're part of a paradigm shift in our field, and they're becoming something that we need to really consider as, best treatment for our patients. So yes, there have been other sealers before that have done a very good job. They've gotten us to where we are now in endodontics, but we can always strive to be better, and I feel like BioRoot Flow is helping us do that. So I've done about 100 cases so far with BioRoot Flow, so I was able to get a little bit snuck over to me, if you will. And I'm actually very, very impressed with the product. So I do want to talk with you a little bit about my thoughts on this. So going back to basics, what are we trying to accomplish with obturation? Obviously, we're trying to create a seal that is going to be impermeable, if you will. I actually did have one of my assistants who was supposed to be handing me calcium hydroxide hand me sealer, and she had extruded some into a tip and then put it onto the calcium hydroxide and didn't tell me. And you can imagine, I thought I'm placing calcium hydroxide in a canal, and I was very interested when the patient came back for their second appointment to find out that there was something rock solid in the canal, and it was white. But the patient was feeling better. I was able to essentially retreat my own case and then finish the final obturation, if you will. It was kind of, an interesting scenario, and I had to remind her, please don't put sealer into a syringe and then switch it over to the calcium hydroxide and just tell me it's a white paste and go for it. It all worked out, if you will. But I do know that these materials, bioceramics, they set well. And now I know this from having to retreat this without gutta percha. So I know that they set well, and they are antimicrobial, and that's what we're looking for. We're trying to prevent contamination for our patients, and the best way to do that is to create a tight seal. And I can say with a lot of certainty that this product does that. So we know when we're looking for a sealer, there's a lot that we're looking for, right? We're looking for something that's going to be retreatable, but we also want it to be strong. We want it to be antimicrobial whenever possible. We want it to be affordable. We want it to not stain teeth. We don't want it to dissolve in tissue fluids, and we like it to be pure and not have contaminants in it. And we look at different sealers like zinc oxide eugenol sealers, that's like Kerr pulp canal sealer or Roth sealer, which are very commonplace. Many people were taught this in dental school, and even now, calcium hydroxide-based sealers, resin-based sealers. All of those sealers, resin-based, some of the most common being ribbon sealer or AH Plus or AH Jet right now. A lot of dentists are using these products. Those sealers do have some difficulty meeting our criteria in endodontics. But when we look at mineral-based sealers or bioceramic sealers, which are what I feel are the future of endodontics, they're doing much better at meeting our needs in our field. So many of us learned cold lateral compaction as the way to obturate. And the idea was that you want to maximize the amount of gutta percha in the canals because the sealer could not be relied upon. So sealer shrinks. Sealer ends up washing out. The sealer is not antimicrobial. The idea was we needed to entomb, and the best way to entomb bacteria with older sealers was to maximize the amount of gutta percha in the canals. So cold lateral compaction became quite popular. We know that it creates a decent seal. It is very cost effective. It's moderately easy. It's not too quick, but that's what many of us have used for a long time. And then warm vertical compaction became sort of a gold standard in the field. And that is not very cost effective, and it's not particularly easy or quick, but it created a good seal. Single cone technique was kind of a pipe dream, like if I could just stick some sealer in there, shove a gutta percha in, wouldn't that be great? That would just make everybody happy. But the problem is sealers shrink. There are voids everywhere, and this is not really creating the seal that we need. So all of this has created a lot of challenges in endodontics. So now with essentially hydraulic sealers. Hydraulic meaning that it's going to be setting in the presence of moisture, and you're going to use gutta percha to hydraulically condense your sealer out into those dentinal tubules and into those lateral canals. Hydraulic force and then hydraulic setting. Hydraulic sealers using bioceramic materials such as BioRoot flow are what I feel are the future. So they're part of that paradigm shift, if you will. The idea is that the sealer is the star of the show, not the gutta percha. The gutta percha is there to make it retreatable. It creates like a core, if you will, a pathway to retreat if you ever needed to go back in. And it also allows for condensing down in the full length of the canal to allow the gutta percha to push sealer into the intricacies of the root canal system, into isthmuses, into lateral canals, etc. So it's essentially quite similar to single cone technique, except for we're thinking critically and we're using sealer that will accomplish more than what previous sealers would use. So it almost seems too good to be true, if you will. And as an endodontist, I'm happy it is true because, obturation can sometimes be unpredictable. But I do think that with hydraulic sealers and bioceramics, as they're also called, I do think that this is possible. So it's essentially a modified single cone technique, but we're maximizing sealer, minimizing the use of gutta percha, if you will. So BioRoot flow did come about in a way as a relative to biodentin, which has actually over 900 publications now. I believe it might even be over 1,000. And then along the same lines in 2015, BioRoot RCS came out, which is a hand-mixed bioceramic sealer from Septodont. It's an excellent product. I've used it many times myself. As an endodontist who is doing cases all day long, my staff, though, they didn't get too excited about mixing the product constantly. If you're doing endo, maybe once a day or twice a day, I think that hand mixing would be very appropriate. You don't want your assistant just leaving the cap off of the, of your sealer. And so maybe you do want something hand mixed. That's up to you and up to what your practice prefers. In the practices where I work, we would prefer something that was syringeable. So you can do it either way, but with the BioRoot flow, I like that it is ready to use and I'm able to inject into the canals. And then after I inject the product in the canals, I take the tip off, the lure lock tip, and I dip my gutta percha into the hub to be able to use sealer from there so that I don't have to extrude more onto a mixing pad, and I'm able to reduce waste and minimize cost. So using what's in the hub of the lure lock tip, take my gutta percha, and then I place it. So I maximize the amount of sealer in the canals. The sealer is the star, and I'm a big fan of sealer puffs when there are lesions. Not talking about putting sealer puffs in places where they shouldn't be. Sealer puffs when there are lesions, I think it is appropriate. And with a product like this that is biocompatible, I think that it is not harmful, and in fact, it may actually be helpful. So BioRoot flow allows me to do that. And another thing that's really nice is if you want to use cold or warm obturation techniques, you can do either one. BioRoot flow will set in the presence of moisture, so it is hydrophilic, which is nice. We're always worried about getting the canals dry enough. Resin-based sealers don't really set in the presence of moisture, and there's no way you're getting it totally dry, by the way. But BioRoot flow will set in the presence of moisture, and that moisture comes from the inherent, essentially, humidity of dentin. So dentin has inherent moisture. Because of that, that moisture comes from the dentin. If you use heat, warm obturation techniques, you don't have to worry about evaporating off the liquid in your sealer, because that's not the concern. The liquid, if you will, that is allowing it to set is coming from the dentin. So you can do cold or warm obturation techniques and you're good to go. So you're not going to end up with a chalky sealer, which is a pain that some of us may have experienced with other products, but it's really excellent. So it's very versatile. So that's one thing that's nice about BioRoot flow. So here's a nice image of the package. So you end up getting the syringe, you get some tips and also a finger grip that go with it. And I wanted to show you a few of my cases that I have completed over the last couple of months using this product. So this one is kind of cool. You can see this little lateral anatomy here. I feel like the product does, as the name implies, it does flow well. So it goes into some of these places. You can see my small sealer puffs into potential space, necrotic canals and apical lesions. And then you can see this number 14 that I completed on a younger patient, very large palatal canal. I did end up doing cold lateral here. This is quite large, but you can see this almost forked tongue at the apex of the palatal root, and the BioRoot flow did in fact flow down into there. And I like the fact that it's dimensionally stable, so it's not going to be shrinking and it's not going to wash out either. So active biosilicate technology was something that Paul was mentioning. And essentially, the active biosilicate technology is made up of 5 parts. There's a high pH, there's high purity to the product, it's bioactive, it's hydrophilic, and then it is dimensionally stable. So the nice thing about the high pH is that it reduces the risk of secondary decay and it reduces the risk of clinical failure. So when I have cases like this is a case I did a few weeks ago. You can see, on the PA, looks like, okay, there's a lesion. Great, simple root canal, right? But then on the pre-op cone beam, because I do take a cone beam on every case, by the way, there is a lateral lesion. This is the palatal aspect of the tooth. So there is a canal going right there. And when I finished, I got this little puff and I took a lower resolution post-op cone beam to try to minimize radiation to the patient, but confirm my obturation, which then helped me determine when I was going to recall the patient and let me know the likelihood of whether she may or may not need an apico later. Essentially, my BioRoot flow did go where I wanted it to, and I know the fact that it's sealing this, it's going to stay sealed, and it's going to kill bacteria as well because of that high pH. So in terms of having high purity, this is really important. A lot of manufacturers are not manufacturing in-house, or some of them are basing their product off of Portland cement, and they are not having complete control over the quality of the product. So high purity with the ABS technology means, there are enhanced biological properties, and also it does not stain teeth, which is something that we care a lot about. So here's a case that I had completed, and remember how I mentioned not having sealer puffs in places that they don't belong? I'm gonna show you my dirty laundry here. This is healthy bone, healthy PDL, and I did get a lovely little puff here. I was scouting this little apical area because I thought there was something extra going on down here. So I was scouting a lot. And as I scouted, I achieved patency in this lateral canal. And then I got a little ahead of myself and I gave myself a puff here. But I'm not concerned about this because I know the product is highly pure. I know it's biocompatible. This does not concern me at all with this product. If it was something else that was more cytotoxic, I might be more concerned. But with this mineral-based pure product, I'm not so concerned. In terms of bioactivity, it can strengthen dentin through biomineralization and support hard tissue healing, which is something we really want when we're eliminating apical periodontitis. So here's kind of a cool case where there was a little bit of a lateral lesion associated with this necrotic tooth. And you can see I got a little puff out there as well. And I like to know that this is bioactive and it's going to help induce bone healing in that area. And then the fourth part of the active biosilicate technology is the fact that it is hydrophilic, which, like I mentioned, it's hard to get canals completely dry. And you want to still have a tight seal. The fact that moisture is required for setting, in a way, it doesn't make you feel quite as bad when you recognize that there are so many intricacies to the root canal system that you'll never get it fully dry. So here is a really good example. This patient was in their 80s and they'd had this lesion for quite a while. And when I completed this root canal, it was kind of weeping. You use paper points and they just keep coming out just a little bit wet, just a little bit wet, just a little bit wet. You do your absolute best, but at least I know that this is most likely going to set, and I think that I'm going to see success with this case. Some of the other benefits, including the dimensional stability, are that it's going to create a really strong interface between dentin and the gutted percha. That integrity is fantastic, and it's going to reduce the risk of clinical failure. Here's another cute little forked tongue of a palatal root, but I like knowing that this is going to stay. So this is going to stay sealed. It's not just the moment that I completed my case. When I used zinc oxide eugenol sealers, they would always just wash out. And this wouldn't be here in 6 months. But with this, I have confidence that it will be. So like I mentioned, BioRoot Flow, I feel like some of the characteristics that they built on with the legacy of Biodentin and BioRoot RCS, some of the characteristics I really like are that it has good handling and delivery. I like the way that it flows. It's slightly more viscous than some of the competitor products. And at first, I was a little skeptical of that, as you're skeptical about anything in life that changes. But I actually prefer that. I feel like it supports gutta percha as I'm placing it, and I find that my gutta percha is less likely to crinkle on the way down, which is definitely a concern that many of us have. And it's easier to clean out of the pulp chamber than some of the competitor products that I've used. And it also works with all obturation techniques. So if I get a wild hair and I decide to switch between cold or warm, I don't have to worry about that. I'm not going to end up getting a chalky sealer. Here's some pictures of the product. And like I mentioned, I do think that this is a product that many people can use. I do think bioceramics are the future, and I'm very pleased with BioRoot Flow, and I'm looking forward to doing a hands-on demonstration with everyone. Thank you so much.